Um, so now, without further ado, I'm really thrilled to honor and introduce to you the panelists for our next session. These hospital leaders and their staff have been working around the clock to ensure our state's people receive exceptional care while also working alongside of government leaders to coordinate an effective response to the COVID-19 curveball. I can't wait to hear their insights, and I'm sure you feel the same way. Please welcome Rear Admiral Donald Gintzig, President and CEO of WakeMed Health and Hospitals, Steve Burriss, President of the Triangle Region at UNC Health, and Dr. David Waldrum, CEO of Vidant Health. And moderating for us today is Melanie Sanders, Director of Video Production and Professional Development at WalkWest. With that, Melanie, I give it to you.
Thanks so much, Kelly. I'm just thrilled to be here and so excited to talk with our panelists today. You introduced everybody beautifully. Each of the panelists has a different service area, sometimes different types of population. So Steve, you have a statewide footprint in the public hospital. Donald, you have a primary urban service area. Michael, you serve the eastern communities, many of which are rural and have higher percentages of at-risk population. So I wanted to start with, if you all could give us a really high-level overview of the types of COVID-19 patients that you see and who usually needs the most intensive treatment. And Rear Admiral, I'd like to start with you.
Certainly. So the first case in North Carolina showed up in Wake County on March 3rd. And since that time, we have seen a variety of waves come through. It predominantly early on started with the African American community. Then it moved through in our community, some of the congregate living facilities. So then you had an older population. Then it moved through the predominantly Latinx and Hispanic community. Then surprisingly, it moved through the 45 to 65 age group. And during each of those, we have seen the numbers of patients requiring intensive care vary as well. And so early on, it was about 50% needed to be in an ICU, an intensive care unit. At times, that has dropped to as low as 25%. Predominantly, when you went to that younger population, they typically don't require as much intensive care. We peaked for WakeMed in the middle of July and have seen it fortunately decrease. And so right now, it still is predominantly African American, the elderly, and a smaller Hispanic population. And we're back down, as the numbers have gone back down, to around 45 to 50% requiring intensive care. And most of those have some comorbidity. COVID exacerbates congestive heart failure and pulmonary disease and those sorts of things, which requires them to be in the hospital. But we have seen a nice decline. It varies across the state. It grew at different rates across the state, and it's decreasing at different rates across the state as we look across that.
All right, thank you for that insight. Let's go to Steve Burriss from UNC Health.
Thank you, Melanie. Our experience has been really similar to what Donald described since the beginning of the pandemic. We've treated over 2,200 patients across the UNC Health system. The waves that he described are exactly what has been our experience. It has turned out different than I originally envisioned when this started, in that I assumed that the population centers would really be hit hard and early, and that really didn't turn out to be true. Throughout the pandemic, our facilities in Wayne County and Johnston County and Nash County have really had patient censuses that rival those of our Triangle hospitals. So it's been interesting that those communities have been hit hard, and I think it has to do with somewhat the groups that Donald identified in his discussion earlier. And like WakeMed, we've seen a decline in the number of patients across the system that we currently have, and we're at our lowest level in about 3 months.
Good. Okay, good information there. It's always nice to get some positive news. Thanks, Steve. Let's talk to Dr. Michael Waldrum. What are you seeing through Vidant Health?
Yeah, I think it's very interesting. A couple of themes that are important is that the way the virus spreads in communities happens in a very predictable way, and we know that way. And it happens very in local waves. And so we're in a different phase than what was just described. We've actually had this last week, the highest census on average around 120 patients through our system. And as Steve mentioned, we really saw it hit more rural environments earlier, and they kind of peaked and their waves went up and down. And now we're seeing more in Pitt County and some of more urban areas, although we don't have a lot of urban areas. But we've seen a lot of increase in admissions over the last week or so. We've also unfortunately seen our highest death day in the last week with 6 patients dying. We've had 1,442 patients cared for in the hospitals and 180 deaths. And similar demographics, importantly, patients that we treat in the ambulatory setting and just with testing, we have very robust testing outreach programs. About 38% of the positives are African American and about 35% are white. But when you go to those that need hospitalization, 57% of our hospitalized patients are African American. And then the age differential, it impacts folks in the more advanced age, and they have higher mortality rates than younger kids. That we've seen an increase in younger populations over the last month or so, primarily with the universities opening, with a very large increase because of students coming back to campus. But that didn't lead to as many hospitalizations.
Okay, good information. Thank you. Let's move on to capacity, which was an initial concern for hospitals and, quite frankly, a concern for just the general population. It appears that our statewide capacity levels are manageable. So what are your planned operating models in a world with COVID-19 for the foreseeable future? And since we're looking at you, Dr. Waldrum, let's just start with you.
Well, when we talk about capacity, I just want to, I've really enjoyed this morning's session, but I think all of us, when we think about capacity, I think a lot of people think about physical capacity. I want to just start this by giving a shout out to all the healthcare workers, the physicians, the nurses, technicians, because we run operations that run 24/7, 365 in our communities. And we all take that responsibility very seriously. And the issue that we all faced in the nation and here locally is that healthcare has not been funded traditionally for surge capacity. And we've all known that in healthcare, but I think that's kind of a unknown thing outside of healthcare, because most organizations do not get paid to have excess capacity. And so we generally run at capacity on any given day historically. And that's what led to the need for us to decrease routine care to create capacity for the wave and the surge. And we didn't know how it was going to come. And so that impacted us pretty significantly by doing that, because as I mentioned, the waves hit different communities at different times. Now where we are is essentially we're running at capacity with, as I mentioned earlier, 120 COVID patients in our institutions. And so we're constantly battling that. We typically have to deal with that issue of having human capital and physical capital to take care of surge in the winter with the influenza vaccine, with the influenza season. And so I think right now we are at capacity and we're concerned, and I think it's important we all know our responsibility and everything, which is to do what we each can do in our businesses with washing and wearing masks and social distancing, because we're having a flu season. So we're all preparing for a flu season, and we're really just maxed at our capacity. And long term, I think we're all very concerned. I know I am, about just the human element of our providers with this pandemic ongoing, and the stress that creates in our organization for our nurses and our physicians into the winter and into the spring.
Okay, thank you. Steve, let's talk about the capacity at UNC Health and what are your plans there?
Sure, and again, our story is fairly similar in this case to Mike's. We expect to be treating COVID patients for a long time. We're fortunate to have many UNC researchers and physicians who are doing great work, like Dr. Wall, who was on one of the previous panels, looking for innovative treatments and vaccines and doing that good work. And so it's good to have that sort of resource within our system. Our operating model supports treating COVID, non-COVID patients at the same time, and we've been doing that for many, many months now. We can't ignore the existence of the cancers and heart disease. Those things continue throughout the COVID crisis. Even with relatively low COVID census numbers that I mentioned earlier, like Mike mentioned, we also are at capacity. In fact, UNC Rex in Raleigh had its highest census day of all time last week. So the other health needs of our community have not let up through the crisis. And the stress that comes with a system that is already operating at capacity, and then you put on it the complications and the demands that COVID places on it, really has put a strain on our workforce. And this, as this has gone on for many months, we don't see an end in sight. And so caring for our workforce is really a top priority for us, because this takes an emotional toll, it takes a physical toll, and we really need to be mindful of that of our coworkers. And I'm talking about record days in the month of August and September, and those things usually occur during the winter months when flu season is in full effect. So we have some busy months ahead of us, and we have a tired workforce that's going into those busy months.
Good to know. Thanks, Steve, for that insight. Rear Admiral, let's talk capacity when it comes to WakeMed.
As was addressed by the others, it really is something we do every day. And so we try to make sure we match resources with the needs. And being the community safety net hospital, we have normal times where we're at capacity during the winters. It drops off a little bit in the summer time, and then starts to head back up as most other organizations in healthcare do. And you have to match that, because you don't want excess capacity that is expensive and doesn't utilize those resources that we have effectively. And so we have an amazing capacity management team that has certain levers and where it can move patients and hold patients and open units and adjust units, and really to be able to accommodate that wide spectrum. I mean, even at our highest point, we only had around 10 to 11% of our patients with COVID positive diagnosis. And so we care for a lot of other really sick people that have needs. And we adjusted some of those less urgent cases down during the early months, where we prepared for the potential surge that we saw in Europe and in the Northeast and the Northwest. And but we've also seen the impact of delaying care since we've adjusted back open. And so really for us, it's trying to match what the needs are now, what we project the needs could be in the next several months with flu season coming around, potential impacts of vaccines, businesses reopening, schools reopening, and those aspects. So we manage capacity and meet the needs and have a system where we work with the other health providers in our community to respond as things are needed as well.
And before we move on to the next question, I really want to make sure that I encourage the audience, any participants, to go to the Q&A section of the panel at the bottom screen there. And if you have a question for any of our panelists, please go ahead and type it in. We're going to reserve about 5 to 10 minutes at the end and answer some of those personal questions that you have. I know a lot of business owners out there and employees want to know how this is going to affect our business long term. And these panelists are obviously very knowledgeable when it comes to the healthcare impact of COVID-19 in our community. So if you have questions, please ask, and we will get to those before we wrap up this panel. All right, so all of you touched a little bit on the other services beyond what you're providing for COVID-19. And what we really want to know is how has the pandemic altered those other service lines and or the ability to serve people with routine care and scheduled surgeries? Steve, let's start with you.
Great, thanks, Melanie. It has had a tremendous impact on all of our service lines. Early on in the pandemic, all of us across the state, of course, paused elective surgeries. And in the end, that ended up probably being a good thing. It helped us get a better handle on our PPE. It helped us get used to caring for these complex patients, which there wasn't really great evidence on how to treat them, but everyone was doing the best that they could with a very new disease. So we put in place lots of safety measures and gradually reintroduced all the other care back into the environment. And so life continues. Since March, we've delivered over 5,000 babies in the Triangle hospitals alone. Our Chatham Hospital opened a new birthing center in the midst of all this. And so things continue to move along. Telemedicine has been a game changer. And I know the keynote speaker today touched on telemedicine, and we really need to encourage the insurers and the governmental payers to continue paying for telemedicine. We immediately experienced a surge in requests for telemedicine visits, and I think since March have done over 140,000 visits virtually, which is a huge uptick from what we were doing previously. Interestingly enough, our busiest clinic is actually the Respiratory Diagnostic Center here in Chapel Hill, and we opened that early on in the pandemic to make testing more accessible and more safe. That is now actually our busiest clinic in the system. So it's hard to sort of overstate the amount of change that we've had to deal with in order to accommodate an environment where COVID, non-COVID patients coexist. We've had to deal with creating positions for screeners to make all of our entrances safe. We have PPE monitors who make sure that our caregivers in the areas caring for COVID patients can safely don and doff their protective equipment. We've had to deal with an environment where we didn't allow visitors in, and at the same time, we've also had to deal with an environment where we reintroduced visitors. So the amount of change is ongoing, and I think is going to continue until we have a vaccine that really makes things safe for everyone.
Absolutely. All right. Thanks, Steve. Admiral, let's talk about you when it comes to at WakeMed, how have the service lines or the ability to do, like, especially things like elective surgeries and scheduled surgeries, how has that been affected?
Sure. Elective really is just a scheduling term. And so people think elective means it doesn't need to happen. It's kind of, well, I may have it, I may not. It really is just a timing term. We very rarely do surgery on somebody that doesn't need surgery. And so from that standpoint, we had the ability to delay some cases that were not as urgent, but it doesn't mean that they didn't need to happen. And so if you've got back pain and you've had to live with that for 5 months, and then we need to do surgery to help relieve that, but we need to delay it because it doesn't need to happen today, there are second and third order effects that can happen. You're on opiate, potentially pain medicines longer. Your quality of life is down. You're not able to get and move around as much. And so therefore you have circulatory issues. And so what we saw as we kind of closed down a certain amount is the number of patients coming in with heart disease and strokes drop off. Well, we know that that didn't cure and eliminate heart disease and strokes across our community. And so we had people sometimes delaying care to come in. And so what we saw when things kind of opened back up a little bit was that impact of the additions that Steve talked about of adding more virtual care and how you redesign flow to make patients with respiratory conditions addressed and cared for to protect our staff and protect the patients and protect their visitors and family. And then how we have really amazing processes in place to protect other patients and their families and visitors and our staff as well. And so, as he mentioned, births are up and surgeries are back up, and normal visits are up. ER visits are down a little bit, but the intensity of those visits are up. And so I think that's a byproduct of moving to more virtual urgent care, more virtual care. Again, people still need to go see their primary care physician. I worry because the number of children being vaccinated across our nation is down dramatically. And we're going to see the impact of that, maybe not tomorrow, but we're going to see it in 1, 2, 3, 5, 10 years. Getting your flu shots, getting your diabetes medicine adjusted, getting your hypertension medicine adjusted, you still need to do that. And so all of us have worked really hard to make care available at the most appropriate level, but some of that needs to take place in a doctor's office, in a hospital, and all of us have worked hard to have that be safe for our staff, but especially for our patients and their families.
I know that healthcare workers are really working hard to encourage people who need those scheduled surgeries or need those vaccines to come in. And Dr. Waldrum with Vidant Health, what kind of message or what are you seeing to really encourage people to feel comfortable now coming back into the hospitals to get those necessary surgeries and to make sure that people are getting the preventative care that they need?
Yeah, so I think that important to globalize it. You mentioned preventive care. So, you know, we serve 29 counties. Rural Eastern North Carolina has a high burden of chronic diseases, which is heart failure, diabetes, hypertension, obesity, and chronic respiratory problems. And so, as has been mentioned, you know, COVID came in, but those diseases that our people live with didn't go away because COVID showed up. But there was a lot of fear, and so people have continued to stay away from seeking needed care, and we've documented real, you know, tragedies where people didn't come in with chest pain that ended up killing them at home and things like that. And as been mentioned, we're all very confident because we have the data to show that we've created highly safe environments, and probably the safest environments in our communities are the hospitals and the clinics, because we've learned very rapidly how to make sure that we take care of our team members and our patients and their families in a safe manner. And so I think, you know, the importance of getting the message out, so we're actively messaging that we have that safety, and that fear shouldn't prohibit you from getting important care, because as has been mentioned, there's this other crisis out there. And I think that, you know, we see it in advanced presentations of cancer, or people coming in with more significant strokes because they ignored symptoms because of fear. So I think just getting the word out and helping reassure folks. The only other thing I would add, you know, we've done very similar things. Has been mentioned, we also have outreach programs, digital trucks that we drive through neighborhoods, messaging about, you know, social distancing and getting testing and dealing with the pandemic. And we test everybody that's coming in, for instance, for an elective procedure. And we've shown that we can take people in for those more elective type events and keep them very safe through those events of care. So we're really just trying to encourage people to get the needed services that they need, because we think we're going to see this other wave of chronic disease, and we are starting to see that.
Of course, problematic. Let's talk about something I'm sure that a lot of business owners are dealing with when it comes to, you know, somebody in their business could potentially have been exposed to COVID, you know, maybe somebody in their family, and they want to know, like, what type of COVID-19 test do you employ in the hospital, and what is the result time? We talked about this when we had our pre-call, is nobody wants to think that they're going to take a test and then not find out the results for a few days, which could be problematic for any business. We're Admiral with WakeMed. What sort of test time, result times are you seeing?
We have a number of capabilities. So we have some capability around getting a test in 45 minutes. We have capability around getting a test within 15 minutes. We have 4 to 8 hours if we batch them. And then we have relationships where we send them out where it sometimes takes 2-3 days to get that. And so really it's about identifying, as Dr. Waldrum said, who needs it right now because it's going to help in the course of treatment. Who needs it because they potentially were exposed, but they can still isolate themselves. And so they don't need, because all of those tests have limitations on some aspect of it, whether it's the availability of reagents, whether it's access to some of the pipettes that are used to draw the test. I mean, there is not an unlimited supply. And part of the reason we all have multiple platforms of testing is because the same way we see shortages around masks and gloves and those sorts of things, we're all challenged as the entire planet ramps up their testing capability. We see some shortages in that. So really it's based on pre-procedure testing. We want an answer right away so that our staff and the patient can know. Coming in through the emergency room with conditions that require an admission, you want that as a 35 to 45 minute test so that you're able to get them through. Others where they're symptomatic but can be at home, you can wait a little longer before you get those results back. So we have a spectrum, and we're always looking at new platforms because, again, availability of supplies to support those impact all of us.
Okay, Steve, is that similar to what's going on with UNC Health?
It is. You know, early on in the crisis, we were fortunate to have experts in the environment. Dr. Melissa Miller is national expert on testing, and she developed a test for UNC that could detect the virus very effectively. And so we relied on that early on. Unfortunately, because of FDA rules and things like that, we really couldn't share it with other health systems, but it was a huge help to us early on. And so we relied on that for a while until the commercially available large quantity tests were more prevalent. And so like WakeMed, we use a variety of the PCR tests. Some have a 45-minute turnaround, others have a 4-hour turnaround. We just completed our 100,000th test last week sometime, and our average result time in terms of getting all the results, so it's sort of from collecting the test to getting the results back to the patient, is well under 24 hours.
Oh, okay. What about you, Dr. Waldrum? Is it similar test time results?
Yeah, so we were very fortunate, similar, our relationship with Brody School of Medicine. We invested very aggressively in multiple platforms. We've done 110,000 PCR tests. And the turnaround test, depending on the platform, is variable from 30 minutes to 4 hours. Because we all know in healthcare that tests that take 3, 4, 7 days are essentially meaningless in helping us be efficient in how we use our resources and take care of patients, and I will say, and how the society responds to the pandemic. So this is one of the most strategic assets that we have in our battle against COVID. And I think the most important thing that I would add is that there is so much confusion around the type of tests and when to be tested if you're out in the community. And so we have a line where we encourage people to call to get answers and get navigated into the right test, because some people call and say, I got exposed today, I need to be tested, and that's not really the pathway. And so helping people navigate, so 252-847-8000, you can get answers on how to access the right test for the situation. We've embedded testing, rapid testing in all of our communities with the objective of protecting our employees and our patients, but also in protecting our local businesses. And so we've used our testing assets to go to businesses to keep their plants open and to keep and to help them have knowledge that they can get back within hours to protect their economic livelihood. We run about 1,500 tests a day. We have capacity at 5,000 tests a day, so we're very fortunate to have that excess capacity to help our businesses and our communities stay safe.
And one of the things is that you mentioned, sometimes people don't know when to get a test because they think they've been exposed or not sure. They don't know what real symptoms. We've heard so many different things of what this virus looks like. So I'm really interested to hear about what all of you have seen when it comes to how the virus presents itself and how it's impacting like various people throughout the pandemic. And it's kind of hard because we hear one symptom and then we're like, whoa, we never heard of that one. So kind of interested to see what you guys are actually seeing in the healthcare world. Admiral, let's start with you.
Certainly. Change has been the buzzword because as we have all learned globally, nationally, and in our community, how this virus presents itself. And there is no one specific presentation. And so when you look at the list of symptoms, one sneeze could qualify. And so we have, from our screening processes, evolved and adapted really to be able to help identify when and what is warranted in terms of testing and what the courses of treatment are. Our treatment processes have evolved and they're amazing. And our staff has performed brilliantly with changes that happen sometimes daily in terms of, symptomatology and processes and those aspects. Really, it is about, from a testing standpoint, nice to know I got exposed. When am I potentially going to be symptomatic, and does, as was addressed, do I have something else that may having the virus in me may make it worse, that I do need to be hospitalized, potentially in intensive care. So you've got that broad spectrum of folks who are asymptomatic and may have the virus and therefore could spread it, which is why wear the mask, wash your hands, because it's about slowing the spread, right? None of our efforts have been around, you're gonna stop this virus across the world, because it's a virus and it's really small and they're really good at spreading. It has been around slowing it down to especially those vulnerable populations which overwhelm the healthcare delivery system, to give our amazing researchers a chance to develop a vaccine so that we can inoculate the population. And so much of what we have focused on has been around treating those identifying, still urging isolation so that you don't spread it, getting test results so that they know. The antibody tests are sometimes helpful and sometimes not, as that's evolved. And the whole testing process continues to expand with new innovations and access points.
So Steve, what about your thoughts when it comes to what UNC been seeing throughout this pandemic and how it's presenting itself and how it's presenting itself now?
Yeah, the virus presents itself in so many different ways, and it's evolved over the course of the pandemic. And there's nothing necessarily consistent about how it presents itself. We have gotten better at treating it. And I think the key is broad availability of testing and rapid results. And it doesn't have to be 45 minutes, but those can be prioritized. But results that come 3 or 4 days later really aren't particularly helpful, but results within a day or two are particularly helpful. And so we've focused our efforts on that and opening respiratory diagnostic centers in order to make sure that we're getting people tested. We have hotlines to help them decide whether they need to be tested, those sorts of things. And of course, in terms of treating it, the availability of drugs like remdesivir and dexamethasone, and knowing that those are helpful in treating the disease has helped us reduce the length of stay of our patients from when we started this to now. That length of stay is much shorter because of the availability of those treatments.
We're getting some really good questions in, so I want to hop on to these questions. And Steve, while I have you up, you can answer the first one. What kinds of things are you doing to support your providers and nurses that are experiencing burnout or likely will in the fall?
Yeah, that's a really good question and top of mind for us. I've said this at other times in the thing. We're fortunate to have a lot of experts on our staff, and Dr. Samantha Meltzer-Brody, who leads our psychiatry department, has really been helpful. And some of her colleagues have actually developed an app to help people identify burnout and symptoms and identify behavioral health concerns. We're doing our best to recognize our coworkers and to keep the enthusiasm and the spirit up in the organization. We're conducting surveys of our coworkers to identify areas of concern. And it's a challenge. When the pandemic first started, there was just wonderful support from the community. Heroes Work Here and lots of donations coming in to support healthcare workers. And naturally, over time, those things have slowed down. And but for our workers, that crisis continues with really no end in sight. And so you work all day around patients that potentially expose you to a deadly virus, and you have to go home. And that's really hard. So those behavioral health and emotional support resources that we put in place, we hope are catching people at the right time. But this, there's not a lot of light at the end of the tunnel for our workers, and we're going to have to make sure that the community support continues or ramps back up. I think that would be helpful.
We are certainly appreciative of everybody in the front lines. That's certainly true. Thanks, Steve. Dr. Waldrum, let me give you another question. This is something that people probably are very interested in. What is the difference of accuracy of the 14-minute, 45-minute, et cetera, tests?
So accuracy, I'm not sure I know exactly what that means, but sensitivity and specificity is how we talk about tests. And so sensitivity is, if you have it, will it find the virus or not? And so, as Donald actually alluded to, you have to be careful, frankly. And I think it's important to know and have confidence in the testing and the testing accuracy or sensitivity and specificity of the test. And there's been issues with that. And so specifically the test that's being referred to, it's hard to know the exact makers and what time frame. The gold standards are the ones that you've heard about. PCR testing is by far the most sensitive, with sensitivities in the 99 percentile and very specific. And we are starting to do more antigen testing. they're probably in the 95th percentile. And so they're pretty good, but 5%, missing 5% can be serious. We in healthcare use PCR tests because it is the standard. And I was going to say this earlier, we've talked a lot about testing, and you've heard it from taking care of patients and using it to take care of patients. And so the type of test and the sensitivity and what you're willing to accept on sensitivity and specificity is highly dependent on what you're using the test for. So if it's community surveillance or other type of activities, you may not need as high sensitivity rates. But I think just knowing that, I think anybody that's going to get tested needs to ask that question to know why they're being tested. And does the test have the sensitivity to actually pick up the virus or not? And so I guess that's how I would.
Yeah, okay. This is our final question, and I love this question. I'm going to give this to the Rear Admiral. How can we as community members best support our healthcare workers who are battling this fatigue and stress as a result of the pandemic? Because obviously they need our support as well. So what can we do?
Large cash gifts to WakeMed is a good start. I would say, but believe it or not, the best thing you can do is what we've talked about, which is to wear a mask, wash your hands, protect others from spreading it, and again, support and understanding. As has been talked about, our staff is on the front lines, but they've always been on the front lines. They're with patients that have the worst day of their life through trauma. They're with patients and families who have the happiest day of their life with the birth of a child. And so it is an amazing group of individuals who come together to improve the health of our community. And so just understanding and supporting and being there, it starts a lot with the culture of caring. And most people have servants' hearts that get into healthcare. And so, but it is exhausting. And you know, having business, the community, neighbors that understand. You heard a few incidents of when the fear was out there of some healthcare workers being shunned because they thought they were the vector spread of the disease. And really what we found is, as Dr. Waldrum talked about, is they're some of the safest folks out there, because we have shown that with the processes that they use, they're protected. But it's also making sure that that we have our resources to have personal protective equipment, that you do understand, because again, they've got families to take care of. They've got spouses in many cases that are either staying at home now, or businesses have furloughed them. They've got childcare issues. They've got school issues, trying to deal with all that. And so really it's being supportive of all of the efforts that our healthcare workers are going through, but it's also helping make sure that the numbers of patients that are preventable for them to take care of are reduced, but also that need health care seek it.
Yeah, I would just, I agree with Donald. I'd like to add, encourage everyone to get, and businesses to promote influenza vaccines for their employees and everyone in their communities. This is a big issue on any given year, but especially this year. It is so important to help protect our healthcare workers.
Yes, thank you, Dr. Waldrum. That is so important. Wear a mask, wash your hands, social distance, and get your flu vaccine. All of those things that we cannot stress enough. Thank you so much for Admiral Donald Gintzig, Steve Burriss, Dr. Michael Waldrum. We really appreciate all of your input. We've learned a lot from you today. Thank you for your participation.